Hi everyone. Osteoporosis or silent, it is the biggest silent disease. Yes, usually we'll think osteoporosis will come for old age people. Yes, absolutely. Old age, it is inevitable. But nowadays we are, because of changing lifestyles, we are seeing osteoporosis in young patients also. Lack of exercise, lack of exposure to the outside world, to the sun, there is no vitamin D3. Vitamin D3 deficiency is common. Vitamin D3 is indirectly, it's a bone calcium only. People will think by supplementing vitamins or calcium I can get the bone strength. No, it's not true. Osteoporosis is the biggest disease. It's a silent killer also. It will weaken the bones and it's more prone for fractures. For example, if it is a 80-year-old lady had fall, there is a chance of fracture. But if similar thing happens at a 40 years also, we think that bone is brittle with a similar force. The forces are different. High energy trauma, that's entirely different. That's because even strong bone also can get hit. But 80-year-old lady falling with a small risk, we'll say trivial fall, with the same manner some young people also fall, so their bones are weak. So it's a rough estimation. So what is the cause of the problem? Some medical disorders, like people who use steroid therapy for long because of asthma or some other rheumatoid arthritis, those are the inevitable conditions where steroid treatment is required. Other thing is a cancer patients, those who are on chemotherapy and then bones become weak. There are other medical disorders also that can create osteoporosis, but a normal person getting osteoporosis which is a curable or a preventable is unacceptable. To prevent this osteoporosis, people should be active, change the lifestyles, exposure enough to sun, eat healthy. Everything is required in limited quantities. Don't think only one food will give that calcium or bone strength. Concentrate on that. But every food is required equally good, because every vitamin, all the vitamins or antioxidants will be available in different foods. So each and every food is equally important. Don't neglect other foods which are equally important for your strength, muscle power and agility also. So eating right, that is maintains your health, and don't underestimate outside exposure to the sun. Sun is a rich product for vitamin D3. If you sweat for some time, play in the sun, that is more important. Advise the kids expose outside instead of cut down all computer games. Tell them to play and come outside, exposed to the sun. That gives immense support for their health in the future also. So they can prevent lot of ailments, diseases by exposing out, which is necessary and mandatory also. So go for a walk, evening or morning. People will think which sunlight is important, which part of the day they will have a rich vitamin D. Usually vitamin ultra B violet rays is important, but it will available in 12 to 2. If you go out at that time, there is a chance of sunburn also. More than that, exposing outside and healthy lifestyle, walking, sweating outside, that gives immense bone strength. If you walk, the bone takes required calcium from your foot. Simply if you take calcium supplements or food without doing an exercise, your bones doesn't require extra calcium, because they are not doing any extra work. Whatever you eat, the supplement sufficient calcium also, it won't go to the bone unless you give some work to your bones. Mobility should be there and stress on the bones, then the bone demands extra calcium. From food also it will take. So it is important, is exercise is more important. How to diagnose osteoporosis? People, as a part of general checkup, will do BMD scans, that is called bone mineral density or DEXA scan, to see what is the calcium level. For that they have to stop calcium for 1 to 2 weeks prior to the test. If you are on calcium medication and getting for the test, it won't show proper results. So depends upon osteopenia, means less risk. Osteoporosis, we'll calculate what is the BMD level, -2 or 0 or +2, depends upon levels. We will do the check mainly in the backbones and hip bones or wrist bones, because these are vulnerable or early joints to get osteoporosis. And people present with back pain. How do the people complain of osteoporosis? It's a vague feeling, body pains or myalgias, we'll say, weakness in doing anything, Sometimes they will complain of chronic back pain in the old age people, or some joint pains. In old age people, accidentally will get wedge compression fractures also because of osteoporosis. So osteoporosis, what will happen? The bone strength is decreased. The backbone supports a pile of bones, what we say vertebra. Slowly it start collapsing. Over the time it develops. It's not a sudden usually with the fracture. So elderly people are risk at osteoporotic fractures. Osteoporotic bones, whoever having is, one is the wrist, second is the hip bone and backbone. These are common bone fractures which we will see in the elderly people because of weakness or low calcium levels. If necessary, take supplements, depends upon your age also. Mostly menopause people require calcium in females. Don't neglect it. Even if you are active after certain age, you require small quantity. Inactive people require more quantities. It is not blind rule that everyone take the calcium whenever it is not required also. Simply taking calcium doesn't mean you are getting the bone strength. So there is no point of blindly for everyone ask him to take the calcium, it will create strength. No, that's a misnomer. Don't take blindly any tablet which is not required for your age. If it is deficient, you require it. Yes, certain people requires, depends upon their medical conditions, unavoidable things also. So important thing is cure. Prevention is better than cure. So try to avoid indoor activities. Go for gymming activities or strength training or walking. That will help to release better hormones, increase the bone strength also. Thank you.